Good evening, everyone, and thank you to those joining us and watching the recording. My name is Rob Hatton. I'm the Communications Manager with Grey County, and joining me on the update tonight is Jennifer Cornell, our Director of Long-Term Care, and Dena Leach, our Clinical Specialist for Long-Term Care with Grey County. We do have an update for you this evening. There have been some changes since we did our last video meet and greet here, and that's been quite some time. But just quickly before we get going, I just want to share a disclaimer with you. So this recording is happening on Wednesday, July 5th, 2023. This video discusses matters related to residents of long-term care homes operated by the County of Grey. Please feel free to share this video with others in the Grey County community. And if you're watching this and you have a family member in a long-term care home not operated by Grey County, please contact that home if you have any questions or concerns related to the care of your person. So we do have a few people on with the call with us tonight. So what I would suggest for our format is if you have a question while we're going here, please do type that into the Q&A section just so that we don't lose it, or into the chat. We'll try to keep an eye on that as well. But what we'll do is we'll have Jennifer give her update this evening, and then we'll open the floor for any questions. And with that, I will pass it over to you, Jennifer.
Great. Thanks, Rob. Just get my notes in front of me. So good evening, everyone, and thanks for joining us on this very hot Wednesday evening. We last met virtually on April 5th, and I just can't believe how fast time flies. I believe that this is a really important moment in time. This meeting that we're going to discuss tonight really signals us moving into the new normal of post-pandemic life. One of the most significant de-escalation measures happened last week. So I'll go over those couple of items and two non-pandemic items, a quick update on the Designated Care Partner Program, and a little bit of a highlight about accreditation. So as many of you know, on June 23rd, the Ministry of Long-Term Care released their memo outlining the next steps in their phased approach to embedding the COVID response into our routine operations. And those steps related to masking and infection prevention and control audits. Those changes were circulated to everyone. The updated guidance document was circulated. If you're looking for that information, don't hesitate to reach out. And those changes came into effect on June 30th. So specifically around masking, for staff, students, volunteers, and support workers, masking is no longer required. Instead, masking is based on a point of care risk assessment with every resident interaction. And this is consistent with our existing practices and the return to work protocol following a COVID-19 infection. And masks are no longer required in administrative and staff-only areas, such as offices and lunchrooms. So that's for staff, students, volunteers, etc. So for caregivers and visitors, masks are recommended but not required in all areas of the home. Caregivers and visitors may now join in dining and sharing a meal or beverage in communal areas. And I had a chance to chat with some of the team members of the homes on June 30th. And they said that there was definitely a vibe in the home of happiness and a bit of a sigh of relief. And some residents had never seen the full faces of their caregivers. So that was fun and interesting and a big change, really. At the same time, we are still cognizant of people wishing to have their caregivers wear masks, and so that still remains an option for everyone. And there's team members that wish to continue to wear masks as well. So mask friendly, not required. The item about IPAC audits. So the updated direction from the province is that IPAC audits, which is infection prevention and control, must be performed at least quarterly when not in outbreak. And this is in alignment with the infection prevention and control standards. So the other significant change is around vaccination plans and policy. And so our clinical team reviewed the COVID-19 immunization policy and took into consideration the current conditions, provincial guidance, communicated and consulted with our partners in Grey Bruce Public Health and the Ministry of Long-Term Care. And effective July 1st, the COVID-19 immunization for policy for staff is being discontinued, and mandatory vaccination will no longer be a requirement of employment. This also applies to agency support workers, student placements, volunteers, and caregivers. And the designated care partner policy has also been updated to reflect this change. And as I mentioned, our decision to discontinue the mandated requirement of COVID-19 vaccine was in collaboration and the guidance of Grey Bruce Public Health. Having said that, we continue to see COVID-19 cases in the community fluctuate, but the risk of severe outcomes is reduced due to the high immunity rate in the community and the availability of antivirals. We will continue to strongly encourage everyone to stay up to date with their influenza and COVID-19 vaccinations to help prevent the spread of severe illness. So in saying that, we will continue to make those vaccinations available at the homes for residents, team members, designated care partners, and they continue to be recommended by public health officials. In looking ahead to the fall, we expect that there will become fall and spring boosters available for COVID-19. And when we have that information, we'll make sure that we share it with you, and we'll work to hold clinics at the homes so that it's as accessible and easy as possible for everyone to stay vaccinated. So while we're removing these COVID measures, they remain in our toolbox, and we can expect that we may need to bring some of them back in certain circumstances. For example, in the fall, we may move to universal masking during peak influenza and COVID season. As always, we'll keep you informed and up to date of any changes, and we'll do that in collaboration with Public Health and Ministry of Long-Term Care. A few gentle reminders. Hand hygiene, hand hygiene, hand hygiene is still important. Remember to check in advance with staff when you're helping your resident go out so that medications and other arrangements can be made, and residents must still sign out. Don't visit if you're not feeling well. And finally, I understand that this change of winding down the strategies may be concerning for some, but we all need to remember that everyone in the building has everyone has experienced 3 years plus of COVID strategies and have reviewed passive screening questions. They're well-versed in IPAC strategies, and most importantly, they care about the health and safety of the residents. So we need to just always remember that. Update on designated care partner program. Just wanted to touch base on this. As many of you know, this program was designed as a response to the visiting restrictions, and it has proven to be very successful in ensuring that family caregivers were never completely locked out of long-term care and won't ever again be locked out of long-term care. As you know, we were part of a research project that focused on assessing the value of the program, and the evidence isn't surprising, shows that essential caregivers are essential. So we're continuing to evolve the program so that DCPs become embedded as part of our care teams. As a DCP, you provide support for residents, support for staff by bringing important information and insight into the needs of the residents, and work together to create solutions and plans of care that are truly individual. Many of you recently completed a survey about the DCP program and opportunities. Thank you for taking the time to provide us your feedback, your experience, and your suggestions. We're working to do an analysis of those results, and we'll share that information back with you and talk about the next. To just highlight that last week, the 3 long-term care homes and their family councils held a virtual family event called Supporting Each Other Through the Journey of Long-Term Care. And we had a guest speaker, Deborah Bakhti. Deborah worked as an executive in seniors care for 11 years. And during that time, she also became a residence family member 3 times with her husband, her mom, and her dad. These events provide that experience really stuck with her and prompted her to write a book and then provide these support sessions. The session was recorded and is available if you'd like to watch it. Each home also has copies of her book available to borrow, so reach out to the Resident Family Services Manager for more information on that. It was a great session, really insightful, I think, for us as leaders and team members in our homes, and also for the family members that joined the session. Accreditation. We have made a commitment to becoming fully accredited with Accreditation Canada this spring, May of 2024. There's been a lot of work happening behind the scenes in doing assessments, gap analysis, and creating action plans to ensure that we're providing quality care based on leading practice and industry standards. There will be more information and opportunities for involvement in the fall, so stay tuned for that. And that is the update for this evening.
All right, thank you very much, Jennifer. So we will open it up to any questions. I haven't seen anything come through the Q&A or the chat yet. So if you have something, you can please enter it there now. But if there aren't any questions from that, we can carry on as well. That would work too.
I don't see anything popping up. So I think that over the years, people have become accustomed to doing some follow-up emails. So occasionally we get some emails after the calls with some questions, and happy to receive those and provide feedback. So if you think of something or something that you don't necessarily want to ask kind of live on the call, feel free to reach out. Happy to provide that feedback. And I think it's exciting that we're moving into this new normal and we're ready for it. And I thank you all for coming and hope that you enjoy what the summer has to offer you, and stay cool and have a great evening.
All right, good night, everyone.
Right.